I am Dr. Esha R Shanbhag, Gynaecological Oncologist at Aster International Institute of Oncology, Whitefield, Bangalore. So today we will have a few questions answered about ovarian cysts. So first, what is an ovarian cyst? So first of all, ovaries are the two small organs which lie on either side of the uterus. They release eggs periodically. And ovarian cysts are the fluid-filled collections of the pathology affecting this ovary. It can either be a simple cyst, that is a simple fluid-filled thin collection, or a complex cyst where there is certain thick fluid or a solid content. So what causes an ovarian cyst? So usually in women in their reproductive age group, the most common reason is the hormonal milieu. So it could either be a functional cyst, a corpus luteal cyst, or a polycystic ovarian syndrome. So this is a very common cause for an ovarian cyst. Second, it could be a severe pelvic infections. What happens is with a severe infection that forms a fluid-filled collection which affects both the ovaries and the fallopian tube. Third is the endometriosis, where there will be blood collected inside forming a cyst that is called a chocolate cyst. And the fourth reason is the tumor. It can either be benign or cancerous or what we call malignant. So third is what is the symptoms of ovarian cyst. Usually most of the women are asymptomatic. We identify a cyst incidentally when they come for a scan or on a routine gynecological examination. Rarely they can present with symptoms, and that can be pressure symptoms is the cyst pressing on the bladder, the rectum, or on the ureter. Second is that they can present with pain. Pain is not due to a cyst per se. Sometimes what happens is the cyst tends to rotate on its own or over other structures, what we call the torsion, and that can produce acute pain. Women can present with back pain or certain abnormal bleeding patterns. So how do we diagnose this ovarian cyst? Like I already mentioned earlier, most of the cysts are diagnosed incidentally. Is by an imaging we identify this cyst. So the imaging forms the cornerstone of detection of the ovarian cyst, and ultrasound is the simplest modality where we can identify it. On ultrasound imaging, whether it is on over abdomen or by a transvaginal route, we can identify the cyst. Apart from identification, we also look for other things, that is whether it's on one side or on both the sides, what's the size, what is the content, whether there are any solid contents, how is the surface, whether it is regular, irregular, what is the blood flow, whether there are any septations. So looking at all these features, we tend to categorize the ovarian cyst whether it is benign or it can be a suspicious lesion. Next is how do we treat it. So the ovarian cyst treatment depends upon age, her fertility status, if she is presented with symptoms, and what's the size and the features of the cyst. So if a woman in her reproductive age group has come with an ovarian cyst which is less than 5 centimeters, it's a very simple cyst, there are no symptoms, we can give a conservative management, we can wait and observe. Or else, the second thing is if the cyst is more than 5 centimeters or she is presented with symptoms like I mentioned earlier, like a torsion or a pressure symptoms, or the ovarian cyst has persisted beyond 6 months, then she might need a surgical management. The third most important category is those with a complex cyst. In these women, it needs a further evaluation and surgical removal is usually required. We at Aster International Institute of Oncology, in those women who have these complex cysts, those with postmenopausal women or a very young girl presenting with ovarian cyst, we do a further detailed imaging like a CT scan or an MRI, other investigations like the tumor markers and anything else required. And we, with our team of experts, including medical oncologists, we come up with a comprehensive management plan in dealing with these ovarian cyst patients. Thank you.